Thank you. I'm glad to be here, and it's the first time for me on this global webinar for traditional and integrative medicine. And I thank you for the invitation, and I'm really and this opportunity to share some thoughts with you. And when I see now the title of my talk, the introduction of non-measurable variable in integrative medicine for a deeper understanding and broader therapeutic horizon, it seems a little bit intellectual or complicated or philosophically, but uh, it's not really that, because I'm a really practical guy and work with patient, and I love to be efficient, as many of you presented a lot of technique methods, really skilled, and remedies and explanation about iodine and mitochondria. It was amazing. So I also want to take a practical angle on this consideration that can be helpful for everybody. So why I choose this topic? Because I want to transmit something that it can be helpful for everybody, despite the method, the technique we use. So some of us are TCM, some use Ayurveda, or there are homeopathy or Occidental naturopathy, but also for conventional medicine, it's really useful to take a step back and look also at this kind of variable. We want also to build a bridge between, we stress the need to build a bridge between the conventional medicine and traditional medicine, highlighting the need for a common language, theory, and also give a practical examples that they and staying close to everyday cases, real cases, to see the real impact that the implementation of these can have. And it laid the foundation to a really integrative medicine. So if we compare therapy and healthcare to sailing, this talk will not be too much about boats, sailing, or equipments. These techniques, these remedies, methods that we spoke until now, but it will be more about maps. What is our horizon, until where we can go? How broad and how far is our horizon when we navigate? Of course, our boat, our system, our method, we need it to navigate. But let's take a little step back and consider some. I will start with some practical example that I took from my experience, and maybe you can share some of these experience. We have, for example, two patients, same diagnosis, same histology even, and same treatments, but we have a different, or maybe sometimes opposite outcome. And how can we explain this? With simply biochemical explanation. It's the same histology, same cells, same molecule, but different, opposite outcome. Or sometimes we have two patients with the same diagnosis like before, but they choose, for example, alkalinize the body, and some other that do heavy stuff that acidify the body and too, and both have excellent outcome. Also, it's sometimes difficult to explain with our model. And I remember also one 70 years old man, healthy, in good shape. It was when I worked in emergency care, and he underwent to a screening test, and they did a prostate biopsy, but he had stage 1 prostate cancer, but they announced it to him, and he very bad. It was really hard to him. 3 days later was recorded in intensive care unit, and less than 2 weeks later he died. But no stage 1 prostate cancer can do this. Or another example that is also a real example, a lucky one this time, a middle-aged man man with stage 4 liver cancer. And it was a colleague of mine that is Spanish. He worked in a developing country, and he was quite frustrating, but he could not continue the treatment for this little bit strange way. And okay, fine, good. What we do now? So the doctor thought he cannot grasp it's too much for him, and let just okay finish the medication and come back in 3 months. This patient come back in 3 months later without cancer. So he could relate to me, and it was we came back maybe later to this case, but this is part of our everyday life. There are some other critical issues. We have overdiagnosis and overtreatment issues that are largely discussed, and spontaneous remission, as we have seen, the placebo nocebo effect, as we have seen with this example, and we go a little bit deeper because these uh, exception on our theory, the way we consider the human being and our interaction, how we function, they open a window through a wall of our perception of what is health, what is disease, and really can be revolutionate our way to handle this. Because, for example, we can consider the prevalence of some cancer, for example, breast cancer. If you take women at the age of 40 to 50, we have uh, less than 1% that have to treat the cancer. But when you do study on accident, car accident or other death cause, and you slice and you search, you find that almost 40% of women between 40 and 50 have cancer. But 38% of these have cancer and live well without problem. So it's not the point why and what we're doing with this 1%, but how these 40% of women have cancer, diagnosed cancer, but have no harm. The same is for prostate or for thyroid, even more. Adult between 50 to 70 clinically are less than 0.1%, but if you search the cancer, that we all live with cancer, but we have no problem. So we see that overdiagnosis, when we start screening, we improve like this for prostate the cases, but that rate is always the same. So we clearly understand that the disease are something that you cannot explain with our model. The same thing is with melanoma. Maybe we come back also to speak with that. And all these exception should make us thinking different. And how we try actually to explain that in conventional medicine, we make an observation, sometimes with our linear tools, reductionism, biochemistry, microscope. We make an hypothesis, and then we try to verificate if it's good or not, often with statistics, as I've seen in many studies. I mean, often in acute care, we do an observation, we do an hypothesis. For example, someone has low blood pressure. I do norepinephrine. My hypothesis, it will work, and I can verify suddenly if it's right or not. Emergency care in conventional medicine, it's really efficient. But when we go through chronic disease or degenerative disease, we have to use statistics. Why? Because it means when we use statistics, it means we don't understand the system. We cannot be pregnant 60%. In biology, you are pregnant 100% or you are not pregnant. But we use statistics because we don't understand the system. But in traditional medicine, we take in another way that allow us to include this non-measurable variable. The observation, it's empiric, energetic. We see system and relationship. So we don't make hypotheses, but we build system and models and symbols that can allow us to interact with this reality and verificate most of time in empiric way. So the conventional one is more detailed, but we don't really understand the system and the functioning. And the traditional medicine is more holistic, so allow us to deal also with this variable, but and it, we have to tolerate some theory incoherences as if work. It's okay. So if someone practice TCM sometimes. Um, in theory we have some incoherence, but it's not a problem for Chinese people, but in many other aspects. And with this dual system, we don't have a really mean to communicate, don't have the means to communicate sometimes. And we stress also this need of a common language to build a bridge on between these two systems to understand really deeply, on a deeply understanding of the human or of the living being. So we are actually in this situation because of our uh, human limited point of view. We are limited in space, in time, our experience. We have biased interpretation. Sometimes we inherited this bias. We have lack of observation and law of logic. Sometimes lack of unified vision, lack of theory that allow us to interact, to communicate like a map. For when we are sailing, we use maps to share our position and communicate, to look, orientate ourselves. We lack of tool, intellectual and practical, lack of precision, and some inherited errors. So what is a living being? How can we go a little bit deeper there? Most of time, or always when we communicate, as I said, we are not dealing with the biological reality of the human being, the human, the living being, the phenomenon, but with our model. We see physics, we don't know what is an atom. We have conceived models to explain, and they evolve through the time. And now, the more precise the model, the more we can do with that. With quantum mechanics, for example, we can do exceptional stuff in communication, in really miniaturization. But the more we see in atom, the more we see that there is nothing, just energy and vibration. And this, that when we communicate, we are not dealing with biologic reality, but we are dealing with models. Sometimes we forget this. And it's true in conventional and also in holistic medicine. As I said, as in sailing, we use maps to orient ourselves and communicate with others. But we forgot sometimes that maps is not the territory. For example, one of my master asked me this question: what is a meridian in Chinese medicine? It's a tube where energy flow. It is a cable. It is a structure. What is a meridian? So he said, when I came with the plane to do this lecture, I tried to see through the window of the plane the meridian on Earth. I crossed the Greenwich meridian, but I didn't see. So, like meridian on Earth, help us to orientate and situate ourselves. The same thing, the meridian describe a reality and allow us to orientate ourselves. It's not even we have some structures that correspond to that, but it was just to make an example. And about inherited errors and biases, sometimes we have a cell that is a cell that it's we see healthy cell in a tissue and a unhealthy cell. So there is a process that go through these, but at some point we just put some line here and we say, okay, this is the line, here is benign, here is malignant. But this, we forgot that this distinction, benign and malignant, is completely arbitrary. We decided this. It does not reflect the biology, the biological reality, the process, the continuum that it's in both ways. And the studies on mitochondria, we mentioned a lot of stuff that we discussed on this conference, prove that, and it's really important, but because we have the idea that a cell behave lonely because we have random changes that make the cell full. And this is what just an example, but the same problem exists with viruses, with microorganisms, with inflammation, chronic inflammation like arthritis, immune disease, all this stuff. It is kind of distinction is more close to religious belief than scientific method, and this is a problem. And what we can do to improve our situation? Often in university and school, we are taught that in science only what we can measure is real. We consider that maybe not is real, but we study only what we can measure. In traditional medicine schools, we are taught at least to name and consider non-measurable variables like Qi, Shen, love. Also, we had our chairman that made a wonderful presentation about the role of love in aging. But what is love? In our model, we lack tool and sometimes also vision to explain to our colleague this stuff, but this stuff has a really deep impact in the practice as we have seen. So we need to create shared maps because of course map is not the territory, but the map forges our perception of reality. How broad is my horizon where I can go and how far I can go? Sometimes we put ourselves in limits that we don't even know that we have, that are in our perception. And there are good news. We have ways and tools to integrate no measurable variable with scientific method and discuss this with our colleague. For example, in physics of complex system based on quantum field electrodynamic, not on quantum mechanica. It's one of my professors said that it's an aborted revolution, but quantum mechanics allow us to make wonderful stuff like this, but does not explain the behavior of matter, the behavior of matter, not the matter in a living phase. A living being, it's not explained with quantum mechanics. We have to go into physics of complex system in quantum field electrodynamics, and we can explain, we revolutionize the chemistry and the biochemistry. We can explain acupuncture, why sound can heal. All these changes we have, we put a needle here, and we have instantly a change somewhere else. All this stuff, it's something that we can prove and have a theoretical basis. And organic biology and even living biology are deeply impacted by this knowledge. For example, also the water property, all this, we can explain, for example, the cycle of Krebs. How can we explain it? Only how a molecule encounter themselves. There is currents, there are system phase, the system share a phase to move all these molecules. It's based on frequency. And this is actually how we are made. There is no random cell modification or chains. I mean, a malignant cell that became full and start to grow and grow and grow. This happens on a petri dishes outside the organism. I take a cell and I nourish it, double and grow, but in an organism, it's not that way. And this is really important. I cannot deepen more the topic, but you can see Paolo Renati PhD articles on that if you want to deepen. My goal here is to highlight the impact, to consider this. Uh, with physics of complex system, we have a field rules that allow us to link molecular behavior, cellular on a cellular level, on tissue level, on organ level. Organism and biological system respond to needs, and also how ecosystem interact with themselves, with vibration, and they respond to necessity. So it's a wall. When you see everything, it's a wall. It's not just philosophy, but it's something that it's really proven scientifically. And what is the implication in a practical way? Let me do an example. If I burn myself, it happens something on two levels. Level, it's the reaction, biochemical reaction. I have evaporation of water, I have oxidation, burning, glycolysis, and this is the same for living being and for dead or for organic biology. But in living biology, I have another layer that it is rubor, tumor, calor, dolor, functionalisa. The symptom of inflammation. It's just the answer of an organism to an insult. Because this insult means something not for the cells that are here, but it means something for the organism. And this organism, it's living only when it's coherent. And this answer is just the answer to keep these currents. So we will have inflammation, all this process to rebuild the tissue. And this is important because we have nothing in our body since one cell, since the development of the embryo until now. Not one cells behave for himself in the body, but there is always a reason. And this reason is a non-measurable variable, but it's something real. The non-measurable variable are emerging property of complex system. And they have a deep impact as we have seen with all the example I made. And what does it mean in practice? En fait, actually we can illuminate actual medicine sense shadowy areas that we cannot explain, like nocebo-placebo effect, spontaneous remission, all this problem with over diagnosis that cause of the problem. It's no logic without this. And give us also more on a foundation and a language to create a really integrative medicine. An application limit is just creativity. Yeah, I like the lecture on impact of love on longevity, but even for some that work only with conventional medicine, even a surgeon that is treating a woman that is a breast cancer, it's really different, the communication and the awareness he have. If he say just, okay, you did mammography, we found something, and we did biopsy, so we can label you as cancer patient because you have some cells there that are present also in half of the women that are crossing the streets right now, but this will not hurt this woman. But we don't know. So please, for this our doubt, let us do this small surgery. He will do the same surgery, but the impact and the outcome will be really different. And the patient that the doctor said, su cancer es terminal, you have terminal cancer. He came, the importance of the meaning, he came back to home, he finished his treatment, but he understood not I am terminal, but my cancer is terminal. Hallowed his biology behave in a completely different way. The same thing is for melanoma. Many horses have melanoma, but when you say to an horses you have stage 4 melanoma, he just do brr, because there's no meaning for him. But if you say this to a human being, we have to really integrate uh, this this way to think in our school, in our how we learn this and how we communicate. So if you compare selling with therapy and healthcare, no matter your boat sale, no matter the method you use, with deep practical knowledge and love, we can cross the ocean. And this was a book that I was reading now, the Kon-Tiki expedition, that one Norwegian people, in 1950, they crossed Pacific Ocean from Peru to Polynesia to demonstrate that it was possible. And so no matter our method, if we consider this way to see the human being and the nature, we will have a really uh, deeper, broader therapeutic horizon, and we can go really far and cross ocean. So thank you for your attention. So question, feedback, possible collaboration. Let's stay in touch. It was a pleasure for me too.